Good afternoon, everyone. Welcome to Cook County Health Department's CCDPH School Health Update for January 19th. My name is Kelly Jones. I am a health educator senior, and I'm the moderator and facilitator for these school health meetings. Happy Friday, April. I saw that in the chat. Let's get started. So we have some great information for you guys. Our objectives are to share updates, information, and resources to help schools navigate school health issues, answer any frequently asked questions, and provide CCDPH contact information and resources. All of our webinars are recorded and they are uploaded to both our CCDPH website as well as our YouTube page. Please keep your line muted. We want everyone to be able to hear the information undistracted. And just make sure if you aren't getting our emails, it could be because you were given me the incorrect emails, because I get a few that are unreturnable, and I'd like to make sure everyone gets the correct information. Our agenda for today, if you haven't seen enough snow, I decided to put it in the, the slide deck. Our welcome, we're going to have a few announcements and resources, a quick update from our communicable disease team. We're going to also have information on healthy food funding program and a presentation for self-care and wellness for school staff. You guys have asked and I have delivered on information on how to take care of yourselves, because you're always taking care of other people and it's long overdue. Couple announcements. Next month, I'm thrilled to have Chief Mitchell Davis, who's the police chief of Hazel Crest, who volunteered to speak to the group regarding violence prevention strategies in schools. And also CCDPH's tobacco unit will be doing a presentation on vaping awareness in schools. So make sure you join us and register for next month's meeting. I am so sad, we've lost quite a few of our treasured School Health Advisory Committee members due to various reasons. They decided to go back home, change jobs, but we miss those trusted voices and we are looking for more. If you are interested in joining, please email me, Kelly Jones at kjones1 at cookcountyhhs.org, and I can discuss the commitment, which is not a heavy lift at all, but those voices are needed to guide us in these in-service meetings, as well as the future of engagement with Cook County Health Department. Our in-home vaccinations, our destination vaccinations, which were the rise to vaccinations, as well as those mobile clinics, have all ended. I decided to keep the slide up for one last month to remind people who weren't here last month about those clinics that have ended on December 8th. If you need to contact Cook County Health Department for any reason, any general emails, you can email our healthy cook at cookcountyhhs.org email address, or if you need to report any communicable diseases, line list, metrics questions, you can email it directly to communicable disease at ccdph_schools at cookcountyhhs.org. And here is our general CCDPH website, as well as the link to our specific school page and COVID vaccine page. Here is information on Cook County Health's clinics. Stroger, as well as our ACHN clinics, were throughout the suburban Cook County area and some in the city. If you are uninsured or underinsured, would like to join county care, don't have a doctor home, and you would like to know where our clinics are, we do not turn anyone away without the ability to pay. So please pass that information on if you know someone who is interested. Here's just a link to our Cook County Health Department events page and information on an upcoming free training session that is open to all, sponsored by Cook County Health Department as well as Illinois Public Health Institute. They're called cross-cutting trainings, tongue-tied. If you can say that twice, I'll give you $1. So there are different trainings that will build the capacity of any organization, any individual who just wants to further their education and learn a few tips and tools. Please register. Our next one comes up this Tuesday. Information for EpiPen and albuterol. I am also the coordinator for those EpiPen and albuterol requests from suburban schools within our jurisdiction. That is suburban Cook County, with the exception of Oak Park, Skokie. I am drawing a blank on the other two: Oak Park, Evanston, Skokie, and there's another one, and I always forget the last one. I'm so sorry, but those are outside of our jurisdiction. And if you
St.
are in
Pete.
Thank you. I always forget that one. Thank you so much, whoever said that. I'm having a break. Oh, in the chat, my friends helped me. Thank you so much. I want to say Burbank. I know that's not correct though. So if you are in those jurisdictions, please contact that health department directly and they can provide EpiPen and albuterol requests from you. The request should come from a medical professional or the nurse, school nurse who is trained in administration of medication. Please make sure you type all of those forms and attach it, please. I can't click any foreign links. Our IT department would go nuts about foreign links. There's just a lot of spam going on, so I'd appreciate you attaching those. Feel free to reach out if you have any questions or concerns. There is also, for those people who've been submitting those requests for some time now, there's a new form that we are required from starting last year. So for that form, you must also submit that and you must state who in your organization who has been trained in order to administer the medication. It can be at least three people, I'm sorry, at least two people in your organization. There's room for three. If everyone in your school gets trained, that's even better, but we need you to list at least two people and submit that with your request. And just here's just some resources because some people ask, how can I get that training or how can I secure EpiPens for free? I have a little resources for that. Also, for those schools who have qualified and are opted into the Rescue Illinois program, this is information for you. I get a lot of inquiries saying, I just got a box of this albuterol. I don't know where it came from. I didn't sign up for anything. Can you help me for anything? If you are in the qualified school who have been automatically opted into the Rescue Illinois albuterol program, that is why you receive that information. You can contact Naomi Soto, whose information is at the bottom of the slide, and she can give you more information on those standing orders or prescriptions or how to get any more information on that program if you weren't aware of the program. If you're not opted into that program, feel free to reach out to myself and I could still help you secure those standing orders and prescriptions. For Narcan requests, you can still contact Denise Holman, who is the opioid health educator in our behavioral health unit. Here is the request link at the bottom of the page for those request forms. And I know I've also been getting a lot of inquiries for the standing order as it is a new law for 2024. And I have been told that they are waiting, they are working on the standard operating procedure and waiting for a little guidance from ISB, and they're going to roll that standing operating procedure out. And you can contact Denise with any further questions regarding those Narcan requests. Just a few of our community resources. We are still trying to make sure that people are aware about boosting up. And we don't just mean for their COVID vaccine. We want to make sure that people, if they need an RSV vaccine, if they need their back to school immunizations, if they need their flu vaccine, we have information on how to boost up and make sure that you and your household are remaining safe for all of those vaccines that you may need. And that's just some more information on our Boost Up campaign, how to stay safe, how to wear masks, and any other vaccine resources. Also, more information if you just came in on our in-home vaccination ending, on our Rise for Vaccination that have ended December 8th, and our school clinics are no longer operating from Cook County Health Department. However, you can still request COVID tests from the government from covidtest.gov. Each household can get 4 tests. There isn't a limit. You can request 4, go back in a few weeks later and request 4. I keep some in the cabinet. Every time I get a tickle in my throat, I went to my COVID cabinet and get some more tests. So you can order as many as you like. If you like some in bulk for your organization, you can order those from Cook County Health Department. We still have a surplus of COVID tests. The link is in this slide, as well as some PPE we are able to offer organizations. We encourage you to request this resource that we are able to offer. A few months ago, I had some mobile vaccination organizations come on because schools have said that they've had issues with families getting their vaccinations for various reasons. So I've compiled a list of those organizations who came on a few months ago who are able to offer mobile vaccinations if your school still needs that. They book out early, so it's not too early to try to reach them to book for the summer or for back to school for the next coming school year. In addition, IDPH has a Wellness on Wheels vaccine mobile unit as well. You can contact them. Just a few more resources on some pediatric disaster emergency preparedness information I received from Lynn at our emergency preparedness unit. Thanks, Lynn, for sending that information, as well as a Red Cross preparedness information and some flyers from our mental health partners and the 988 suicide prevention line that you can text, email, or you can call if you need help or you know of anyone who needs some help. You can just share this information, as well as information from 211.org that you can also call, text, or go onto their website. And it's a nationwide service similar to 311 and 911, but just for resources. And just some more resources I am going to share. Hopefully your school or your organization can use it. And just a one-page link to all of those resources that I shared about COVID vaccinations. I am going to toss it to Lex, and she's going to give you the communicable disease update. Thank you, Lex.
All right, thank you, Kelly. Everyone bear with me 1 second while I get my screen set up. All right, can I get some confirmation that you're seeing a slide?
We see it.
Great, thank you so much. All right, getting into it. I'm Lex Berta. I'm from the Communicable Disease Department at CCDPH, and I'm just going to go over some statistics of what you might be seeing in schools right now, and then what it is you can actually do about it. So we're going to talk COVID, RSV, flu, and we're also going to talk about some GI illnesses because 'tis the season for all of them. So in terms of respiratory viruses, we've got COVID leading the pack. It has been this entire respiratory season. And at the moment, we've got flu coming in second there for hospitalizations. If you remember earlier in the season, especially for young kids, it was actually RSV that was hitting us harder than flu. That has since flipped since the holidays. It is thoroughly flu season. For COVID-19, activity is relatively low, which is exciting, but that doesn't mean it's not still around. Test positivity is still elevated, and wastewater levels that we've collected are still increasing. So there's definitely going to still be an elevated level of COVID-19 in the community. It's just not a hospital emergency situation. So we've just come off of a spike in younger kids being hospitalized for COVID-19. So over everybody's winter breaks, we actually saw a lot of hospitalization in younger kids for COVID-19. And basically, the big summary of this is we're not quite out of the woods yet. We still have to keep watching out for COVID-19 in schools. For RSV, we have peaked, but we're still at elevated levels. So it's still something we have to look out for, but you don't have to worry that it's going to get much worse than it's been this season. If you can tell, the lighter blue lines on the bottom of this graph show what it was like when we had normal RSV seasons, and the dark blue and the red are where we've been at the past 2 years. So you can see it's definitely above where we would normally see. You're not crazy. There's a lot of respiratory stuff still going around in schools. And we are also decreasing in flu. We are also coming up of a sharp increase among children being hospitalized for flu. So the holidays were a bit of a tough time for kids, but we're seeing things wind down just a little bit. Wastewater is still increasing, so we can't say that we've absolutely peaked, but we are seeing a decrease. It's just something to keep an eye on. We're definitely still seeing flu in schools, but hopefully we've seen the worst of it. Knock on any wood that's at my Cook County desk, but I do not think there is any. So we're not out of the woods with respiratory stuff. What is it that we can do? Wash your hands and hang in there. You guys are already familiar with the school guidance for you guys. You guys are already reinforcing hand hygiene and respiratory etiquette. Try to get kids sneezing into the inside of their elbows if you can. Encourage everybody to stay home when you're sick. And I want to emphasize that for COVID, the recommendation is still to stay home for 5 days. And then you can come back once you're fever free, but you do have to still mask through day 10 from either no symptoms, but testing positive, or symptoms start, depending on if you have symptoms. And then for RSV, for flu, for strep throat, for all the other respiratory stuff going around, stay home. You can return to school after you've been fever-free for over 24 hours. If it's some kind of disease that's caused by a bacteria, you should have been on your antibiotics for a little bit before you return. optimize ventilation when possible, get the hood vents in chemistry classrooms going as much as possible. And I'll put these in the chat later, but we've got links so you can stay on top of the most recent data for COVID, for flu, for all the respiratory stuff. And then if you're ever worried that you're seeing a huge increase or there's a classroom that's looking funny, just email our school email. We will walk through those situations with you, help you figure out if it's a real outbreak, help you figure out if it's time to shut down a classroom and do a deep clean. And then IDPH also has example letters of letters you can send home. If you're worried about absenteeism, give us a call. We are definitely here to help you walk through all that and help you stay healthy. If you are the actual school nurses on the front lines with those kids, not a bad idea to be wearing a mask when you come into contact with them. All right, for GI illnesses, it is norovirus season, which is the most common cause of the stomach flu. Hand sanitizer and alcohol-based cleaning, like little wipes you can get in lunches and stuff, that is not enough to kill norovirus. It is a very tough virus. You need the friction from actual hand washing, and you need bleach-based cleaning products when you've got norovirus in the school. Norovirus was really high going into the holidays, as it usually is, but it's now decreasing, so it's still elevated. We're still going to be seeing norovirus, but hopefully we've seen the most of it for the season. In general, obviously, kids shouldn't be returning to school within 24 to 48 hours of vomiting or diarrhea. I know sometimes parents think, oh, they threw up last night, but they're fine this morning, time to go to school. If you're seeing a lot of that, maybe it's time for a reminder letter home. So really, again, hand washing is the best way we can prevent all of this and the most important thing. I'll pop all the data links in the chat, and I will certainly be sticking around for that stress relief bit, and I'll be able to answer any questions you have as well in the chat. All right, I will toss it back over to Kelly. Thank you, everybody.
Thanks, Lex. Just the thought of the word norovirus makes me sick. I remember that smell. It will be burned into my brain for the rest of my life from years ago when my son had it. And thank you for that. If there are any questions for Lex, feel free to put them in the chat, and Lex or someone else from our communicable disease unit will be glad to answer those questions. And while you're doing that, I would like to welcome Colleen Feeney from 7 Generations Ahead and Alexander Rodriguez from Chicago Food Policy, who are going to discuss a food funding opportunity for schools. Welcome, Colleen. Thank you so much for joining.
Hello there, everyone. You'll have to bear with me for a second because I've never used Teams to present. I'm assuming I just click on the share button, but
yes,
give me just a second.
Take your time.
Put the presentation on presentation mode first and then click share, probably.
You can just, if it shows your presentation, you can just click it and it'll pop up on its own. Otherwise, you can click whatever program.
It's not showing up. Oh, wait, hold on. Here we go. That'll work. Just 1 second.
Take your time.
I think that should work.
It's sharing. Great.
Okay, yes. Excellent. All right, everyone. So my name is Colleen Feeney. I am from 7 Generations Ahead. And I would like to share a little bit about 2 things. The first of them is just very briefly our Farm to School program, and then I'm going to tell you about a healthy food funding opportunity that is coming. Let's see here. So I come from 7 Generations Ahead. It's an environmental nonprofit based in Oak Park. We produce a range of sustainability-focused programs for municipalities, schools, and private partners on topics such as zero waste, local food, farm-to-school programming, renewable energy, and more. And 3 of our programs are listed here. It's the Illinois Farm-to-School Network, which is a core partner of the National Farm-to-School Network, the Illinois Harvest of the Month, and the Great Apple Crunch. I'm just going to tell you briefly about all 3 of these. These are the core components of the Farm to School program, and they can be incorporated as a mix or as standalone features based on your needs. We help with procurement, education, and also school gardens. Our network includes schools, daycare, garden programs, farmers, like-minded organizations, parents, and teachers. We have a newsletter that comes out once a month, and you can sign up on the website that's listed here. I'll also put all of the links in the chat once this presentation is over. We provide a full farm to school toolkit, monthly newsletters, webinars, and in-person trainings with one-on-one assistance. This is another one of our programs. It's the Great Apple Crunch, which is a one-day event, and it's a great way to dip your toes in the local procurement waters. 8 states participate in the crunch, and you can crunch on any day in October. Registration's open in August, and on our site, you can find the best practices, resources to local apples, and ways to incorporate the crunch into your school. And then the final program is Harvest of the Month. And participants feature a local or garden food each month, adding food education and celebration to encourage acceptance of new foods. The program teaches kids about seasonal eating and develops student acceptance of fresh, healthy foods. It makes it easy for sites to bring food education into the meal program, the garden, and the classroom. And it also teaches program staff how to buy, prepare, and celebrate local food. And then I will move on to the grant, which is the Lake Michigan School Food System Innovation Hub. This grant is designed to foster collaboration to reimagine school meals in ways that nourish students, connect to local farms and businesses, and celebrate the region's culture and communities. We are looking for anyone in the chain of the school food system to work together to improve equitable access to local, fresh, and healthy food. There are 2 different versions of the awards that are available. The first one is called the Spark Awards, and that is to fund projects that need a short-term infusion of funds for school food system and marketplace improvements, like capacity building, planning, and product testing. These awards can range anywhere from $10,000 to $75,000, and the grant cycle is 1 year with an optional 4-month extension period. This first timeline will go from August 1st through July 31st, 2025. And the applications are opening on February 1st for both of these opportunities. The second one is the Innovation Collaboration Awards, which fund projects that promote systems level change, larger scale projects such as regional partnerships, new program and product development and integration. And these are for $250,000. And this grant cycle is 2.5 years. So that would go from August 1st through December 31st, 2026. Like I said, the first rounds open in February 1st for both the Innovation Collaboration Awards and the Spark Awards, but there will be several rounds leading through 2028. There's a webinar that we are hosting next week on January 24th at 10 a.m. For anyone that wants more information about the program. Again, I will provide the link in the chat so that you can register for it there. But there will be some breakout sessions and Q&A. So if you have any questions, that's like an excellent time to talk to a bunch of people involved in this. And that's all I have to share. I'm going to provide 2 different contact information. Our Farm to School program manager is Diane Chapita. She would normally be doing the first half of the presentation, but she is presenting at a conference, so she was unable to make it. So if you have any specific Farm to School program questions, Diane is the best resource for you. And then myself, I'm Colleen Feeney, and Diane and I work together on the Innovation Hub grant. And that is all I have. So I will pass it over to Alex. Did it stop sharing?
It did.
Okay, good.
Hi, everyone. Thank you. And thank you, Colleen, for helping share information about the Innovation Hub. My name is Alex Rodriguez, and I am part of Chicago Food Policy Action Council. And just to kind of give a really quick background too, CFPAC is actually one of the partners in Illinois that has been helping a lot with the Innovation Hub. So that's why we wanted to make sure we're able to provide this information to schools. But we also just want to make sure, if you need help with like a connecting piece, obviously I know 7 generations ahead that is leading the grant here in Illinois. We definitely just want to make sure that you are all aware that we are different. So there's different supports that have been existing too that has been helping with the grant. And we just wanted to make sure like that you did have like this information. But I'm just gonna quickly share quick slide. I also too have it work with Teams, so give me a quick second. Oh, okay. It seems
Take your
like right
time.
now my no, it seems like for some reason it's asking me. Oh, hold on. Okay. Are you all able to see this quick slide?
Yes.
Okay. Okay, just really quick background, just with Chicago Food Policy Action Council. Our work as a fact, it emphasizes a lot on just helping facilitate and advocate for policies that help advance like food justice and food sovereignty in Chicago, with a big focus on food procurement, food research, land access, and like licenses and permits. We work heavily with Amy at Cook County Department of Public Health with our Metro Chicago Good Food Purchasing initiatives, with different institutions, just kind of working with like evaluating like the food spend and just seeing how we can shift to a more values-based procurements. But that topic is like for like another time too, which we don't have enough time to go over. But I do kind of want to just emphasize too with the Innovation Hub and just like with, how can you find like different resources for finding producers, especially like around like the Chicago area. Part of CIFPAC, we actually do have a huge network of just different working groups from different organizations. It has like a lot of involvement with food producers and farmers and businesses. So this is kind of pretty much a really quick glimpse that I could provide afterwards from after the call, of our different working groups and our call schedules. Just in case, if you are curious just to kind of learn more, we have monthly calls and they all have different topics that we cover. But there's definitely a lot of involvement of food producers and farmers that do partake in these calls. So even if you are just curious or just want to know more, definitely reach out afterwards and I could definitely provide my information too. And one other thing too that I just want to quickly touch on is that in March, we actually have a huge annual summit that we are hosting. It's our 19th annual Food Justice Summit, with the focus being climate resilience this year and just its involvement with food and the environment. The first 2 days are March 6th and 7th, which is online, and then March 8th, which is on a Friday. It's going to take place at the South Shore Cultural Center. And I definitely encourage if you have any time, we are going to be releasing the program soon, and it's free, big emphasis on free, so you could partake anytime if you have, throughout the day. You just have to like just register, and then you have access to the material afterwards too. But I do encourage, if you have a moment, yes, please come and partake. And then usually the last day on Friday is like a really fun in-person event that you're able to connect with more organizations around Chicago and like in the food space. So definitely have like that really quick encouragement. Yeah, if you have any questions, please reach out. I'm gonna provide my email address in the chat, but if you do have any questions, please reach out to either of us. Yeah, either to myself or also again with so many generations ahead. And Colleen and Diane are a great resource. And if you are able to make it, please come to like the webinar on the 24th. Just yeah, it'll be really great just opportunity just to be able to. If you have any questions and learn more, please yeah, reach out to us. And that is all I have. I don't know if there's any questions overall for either of us, for myself or Colleen, but I'll also have like that space too. But I will pass it back to Kelly just in case.
Thank you, Alex and Colleen. If there are any questions for Alex and Colleen, feel free to ask them now. I've been to that food summit. It's great food. It's a great time. So hopefully people can come. South Shore Cultural Center is a fantastic venue if you've never been. If there aren't any questions, I'm going to get ready to introduce our next presenter. I'll give it another minute or so while I pull up Felicia's slides. Feel free to put anything in the chat if you are a little shy and don't want to ask, but it is a great program. You may want to just register for the webinar next week so you can find out more detail about the program, but it sounds like a wonderful funding opportunity. So while I am pulling up the slides, let me introduce our next presenter, Ms. Felicia Houston, with more than 20 years in the mental health field, a BA in psychology and an MA in human development counseling from Bradley University in Peoria. She's a licensed clinical professional counselor, a mental health consultant, a mental health first aid trainer, a trauma and resiliency trainer, and a consumer wellness advocate. Welcome, 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 Felicia. I'm so glad I was able to get you. Let me pull up your slides. Give me 1 second.
Okay. Good afternoon, everyone. And thank you, Kelly, for having me.
No
Can you hear me
problem.
okay?
Yes, I can hear you.
Okay, because I'm with the other presenters. I'm not used to presenting on Teams. I'm used to having meetings on Teams. So,
Teams is loads of fun, I'll tell you. Let me
uh-huh.
move this box out of the way so I can start the slides.
Okay.
Uh-oh, sorry.
That's okay.
It did its own thing. Okay, there you go.
That's okay. Okay, so good afternoon, everyone. It is Friday and it's 2:30. So I know you all are very excited. Exactly. So we're going to go ahead and get started. So the conversation that we're going to have today is about self-care. And I say conversation because that's what this is going to be, a conversation. So feel free to use the chat. Kelly, if you see anything in the chat that just stands out, just yell it out to me because I'm looking at the presentation, so it's hard to do both of them at the same time. Or we could just go to the chat afterwards, but sometimes that becomes overwhelming. So if
No
we can go
problem.
to the next slide.
I'm going to also ask any of my colleagues who are here to assist because that big Teams box popped up and it blocked the chat for myself. So if
Okay,
April
gotcha.
or Diamond can help me or anyone else with the chat, we'd appreciate it. Go ahead, Felicia.
Okay. So before we
Mhm.
get started, I always like to do a check-in to see where people are at, just to get a feel for the room. So the check-in I'm doing today is in regards to cereal. So thinking about your current state, where you're at right now, if you were a box of cereal, which box of cereal would you be? Feel free to put it in the chat. Which box of cereal would you be? Kelly, which box of cereal would you be?
I would be Frosted Flakes because they are great.
I like that. I like that. I like that. I would say that today, right now, I just feel like some plain old Cheerios because I'm just on chill mode because it's Friday and it's 2:30 p.m. So other days I feel like I'm snap, crackling, and popping, but not today. So what are some other ones? What are some that you all are seeing in the chat? Whoever is monitoring the chat.
Lot of life. Seen a lot of responses for likes, Kelly.
I heard Cocoa Puffs.
Okay. Oh,
Teresa said
I can
life for
see
me
it.
too. Okay.
I can see the. I see Life, Cocoa Puffs. And I see a lot of life. Fruit Loops. Yeah, a lot of people say cuckoo for Cocoa Puffs. Lucky Charms, Fruit Loops, Cheerios. So it's just good before you start. And let me say this, like even when you all are having meetings, if you're having meetings with your staff, it's a good thing to just check in with people to see where people are at before you just get down to the business of whatever it is that you need to do in your meeting. Because say for instance, if we're doing a check-in, sometimes I'll do one if on a scale of 0 to 10, where are you at? And one time I did that and one of the ladies in the chat said, I'm a negative 15. Okay, we can't just go on to the next slide because somebody is at a negative 15. So maybe that means that person needs to be spoken to privately. So that's why it's always good to start any meeting with a check-in so that you can get a greater understanding of where people are at. So next slide, please. So I know that the work that you all do is important work. And a lot of times the focus when we're any job that we're doing is how to make things better for the people that we serve. However, the conversation today is about you. So I want you to I'm gonna set my timer for about 2 minutes, and I want you to reflect on these questions. The first question is, how burnt out am I? And if you're not burnt out, wonderful. But if you are, think about it. How burnt out am I? Like on a scale of 1 to 10, where am I at? And then the other question I want you to ask yourself is, am I trying to keep too many balls in the air? So how burnt out am I? Or you can ask yourself, am I burnt out? And am I trying to keep too many balls in the air? So I want you to just take, because we are short on time, I'm just going to give you a minute on this. So take a moment and just reflect on this. And if you're able to put it in the chat, feel free to put it in the chat. Or if a couple of people want to come off of mute and share, that would be great. But just take a moment and think about the stressors that you have right now. Are you burnt out, or do you just have too much on your plate? Is your plate full and overwhelming for you? So take a few minutes for that. A few seconds, not a few minutes. And I'm gonna give about 30 more seconds. Okay, so I'm gonna be honest with you all, because when I do trainings, I believe that you when you're doing something, you should lead by example. So I'll answer first. How burnt out am I? Today I'm okay, but yesterday, if you had asked me this question on a scale of 1 to 10, I was probably at a 10 yesterday. Did I have too many balls in the air? Absolutely. I had way too many balls in the air. And as a result of that, today I sit down and I plan for the rest of this month. And I'm going to make sure that I make changes, because this week was too overwhelming for me. So the stress that I had this week was self-induced stress, because I created my own schedule. No one else created that for me. I did that. And so what I want you all to do is, by doing this type of reflective work, it helps you to figure out what is causing you stress in your life, how you're going to respond, how you responded to the stress, and then what is needed for you to feel better. So please pause regularly and ask yourself these questions. I usually like to check in with myself on Fridays, because it's the end of the week. Some people like to check in with themselves on Sunday, because it's the beginning of the week, as they think about going back to work on Monday. So you figure out which day you want to check in with yourself, but I encourage you to do this, to check in with you to see how you're doing as you do the work that you continue to do. Next slide, please. So when we talk about self-care, there are 950,000 definitions of self-care. And when you go to Google, there are a million suggestions on what you should do to take care of yourself. And what I want you all to do is just pay attention to this right here, this slide. And it simply says, the act of self-care, which is the action of taking care of yourself to achieve better health and well-being, can help you deal with moments of uncertainty and frustration. So I'm going to read it one more time. The act of self-care, which is the action of taking care of yourself to achieve better health and well-being, it basically helps you to deal with those moments. Has anybody had any moments of uncertainty and frustration? That's what the self-care does. It helps us, it better equips us to deal with those moments and times. Okay, next slide, please. I want you all to keep in mind that when we talk about self-care, you can't pour from an empty cup. It's important that you take care of yourself first, so that you can be there to take care of the students. But if you're not taking care of yourself, you won't be around to take care of the students, or you'll be calling off. There'll be absenteeism. People will be calling off because they have not been taking care of themselves. And your body tells you when it needs to a rest or a break. But a lot of times we don't listen. So please keep in mind that you can't pour from an empty cup, and it's important to put yourself first. But what we do a lot of times is like this cup, we put ourselves at the bottom. So after we've done taking care of everyone else, if I have something left, then I'll take care of myself. And what happens usually when we get to the end, we don't have any energy to do anything for ourselves. So keep that in mind, that we want to take care of ourselves first, not last. Next slide, please. This is one of my favorite quotes in regards to self-care. And it simply says, caring for myself is not Did you hear me? Not self-indulgent. But caring for myself is an act of survival. So if I don't take care of me, I will not be around. So I need to take care of me in order to be around and to survive. So please don't take it as, I hear a lot of people saying, especially people that do the work, the type of work that we do where we're helping other people. Oh, it's so selfish for me to do something for myself. No, it's essential for you to take care of yourself. Remember during COVID when they were determining who was essential or not? Self-care is essential. We have to do that in order to continue to do the work that we do and to give 100%. So please keep that in mind. Next slide, please. What I want you all to do is when we talk about self-care is to prioritize your self-care. I'm going to ask you a question. How many of you all have a to-do list and you are on the to-do list? Something that will be for you, like your me time. Is your me time on your to-do list? Put it in the chat. If you, okay, I see some hearts. Thank you. Put some hearts if you make sure that you put yourself on your list and you're not at the bottom of the list. Okay? You can't do everything, but self-care is a must. So I want you to keep that in mind, like making sure that you're on your list and that you're being honest with yourself. You know, one thing that we can do when we all have colleagues, right? And our colleagues sometimes want to ask us to help out. And some of us, we want to help out. We want to be a team player. But maybe your colleague is not managing their time. So then you have to develop the art of no, because saying no is a form of self-care as well. So maybe you need to step back, maybe you need to not help your colleague, or if you're a volunteer and you volunteer a lot, maybe you don't need to do as many volunteer opportunities because that is taken away from your self-care, okay? So next slide, please. So don't forget, we want to prioritize our self-care. The next thing we want to do is we want to schedule it. How many of you all schedule your self-care? So maybe you do yoga, maybe you organize, or I don't, whatever it is that you do, you knit or something. How many of you schedule that? I saw a heart. Thank you. So once you make it a priority, find a place in your school day, your work day, your personal schedule, find a way, a place to put your self-care, because it has to be a part of your concrete schedule. It has to be a part of your routine. So I hear a lot of people saying, oh, I'm going to take a bubble bath. Bubble bath is maintenance. That's not self-care. That's just taking a bubble bath. That's not what we're talking about. We're talking about taking care of your inside and your outside. Okay, next slide, please. Another way that we can practice self-care is practice healthy and mindful eating. How many of you all actually eat your meal and you pay attention? You chew the food, you know what it tastes like, you know what it smells like, you know what it looked like. Or how many of you are sitting there and you're eating and you're on your computer, you're on your phone, you're on your laptop, you're talking, you don't even remember what you ate. So practicing healthy and mindful eating is a form of self-care. So what I want you all to do is treat yourself with the same level of respect and allow yourself to indulge in a meal without distractions. How many of you all have done that? Give me some hearts and some love or something if you practice mindful eating, mindful and healthy eating. Okay, next slide, please. What I also want you all to do is to keep track of your accomplishments. So how many of you all, I know earlier I asked about to-do lists, and many of you all said that you keep to-do lists, and to-do lists are great. They are wonderful. However, I'm going to ask you to keep a list of what you've done. So track your accomplishments at the end of the day. Make a list of everything, even if it's mental, or you can actually write it down. I'm a person that writes things down. So write it down to show how productive you've been for the day. So did you nurture a relationship? Did you forgive somebody? Did you do the laundry? Did you make your bed? Did you complete a work assignment ahead of time? Keep a track of everything that you've done for the day, because that is a form of self-care. Okay, how many of you all do that? You track your accomplishments. Give me a heart or something if you track your accomplishments. Okay, I see your heart, so thank you. Next slide, please. I see quite a few hearts, so good. So again, I want you all to be mindful that self-care is not selfish. It's essential. Next slide, please. Now, everyone on here I know has a cell phone, right? How many of you all like seeing the battery on your cell phone look like this? Nobody. No, nobody likes to see this. So if we wouldn't let this happen to our phone, why would we let this happen to us? Why? Why would we let our bodies get to the point where we are depleted, we're about to shut down? If we care so much about our phones, we should care much more about us. Okay. So don't let this happen again. Self-care is a priority, not a luxury. Okay. Next slide, please. How many of you all practice gratitude? This is a form of self-care that we can all participate in. Practicing gratitude. What am I grateful for? Not thinking about what I don't have, but what do I have? It's good to notice what we have. Keep a journal by your bed. And like, if you can't sleep or something, just jot down things. Like in the chat, I want you all to put in the chat, what brings you joy? Just think about it. What brings you joy? Like for me, clean sheets bring me joy. I don't know about anybody else, but clean sheets, good clean sheets with nice thread numbers, that brings me joy. When I put those clean sheets on the bed and my new comforter and everything, that brings me joy. Everybody is different, but figure out what brings you joy. And if you look on your screen, there's a gratitude jar. So this is something that you can do in the office. And one of the facilities I used to work in, we had a gratitude jar where our receptionist was at. At the beginning of each year, we all wrote down things we were grateful for and we dropped them in the jar. On those days when we weren't so grateful for our job, we would go in there and pull something out and it will remind us why we do the work that we do. So this is something that you can do. I've also seen the big dry erase boards where people write on the dry erase board every day, things that they're grateful for. So when anyone walks by, they can see what people are grateful for. So practice gratitude. There's something that you can be grateful for. Okay, next slide, please. The simple definition for self-care that I like is self-care means giving myself permission to pause. So like I said, it's not about what I think society is making us think. They're making it really commercialized. Giving myself permission to pause can mean give myself permission to pause and do nothing. How many of you all, when the last time you gave yourself permission to do absolutely nothing? Give me a heart if you've done that. Like just, yes, I see some claps. All right, yes, it's good to do that sometimes. Give yourself permission to pause and just watch. I like Law and Order. So sometimes I give myself permission to watch about 15 episodes of Law and Order and then I'm good and now I'm ready to go back to work. But that's just me. Everybody is different. What I also want you to keep in mind is that I love this quote. It's an empty lantern provides no light. Self-care is the fuel that allows your light to shine brightly. So as you do the work that you're doing, you're able to do it once you pour into yourself. You pour into others, then you pour into yourself. Then you pour into others and you pour into yourself. That's what self-care is. It fuels you to continue to shine your light so bright. Okay, next slide, please. So let me ask you this. What does self-care look like for you? What do you do for you? Because everyone is different. It is not a cookie cutter recipe. What I do for self-care, it could cause stress for somebody else. So you want to make sure that you're mindful of that. So put it in the chat. Or Kelly, I'm going to ask you, what do you do for self-care? What does it look like for you?
I had started a Massage Envy membership, monthly massage.
Awesome.
It's a
And
start.
let me ask you this, Kelly. Do you keep those appointments?
I keep those appointments. I do not miss. Yes,
Good.
they help a lot.
Good. Because
And
that's
I don't
what we
believe
do
in wasting
sometimes.
money.
Yeah, I know. We'll make those appointments, but then we'll get so being busy, and then I have to help everybody else. I can't keep my appointment for my massage. Yes, make those appointments and keep those appointments. Again, self-care is different for each person. For me, boundaries is the thing for me. That's what self-care looks like for me. Having boundaries so that I don't let people overstep those boundaries. That's what it looks like for me. Okay, I see Diamond Ross, you have your hand raised. Go ahead. Or were you clapping? Okay, I think
It
Diamond.
was both.
Go ahead. Okay, did you want to say something?
No, I was agreeing. I was agreeing with you,
Oh, okay,
what you
okay.
just said.
All
So
right.
I put my hand up. Yeah, me too.
Okay, all right. Thank you so much. Yes, having boundaries. Boundaries is a form of self-care. And a lot of times I hear a lot of people saying, I have problems with that. And I'm like, well, you're going to need to sit with yourself and figure out why you have problems setting boundaries with other people. Because if you can't set boundaries with other people, then you are creating stress for yourself. You're allowing people to create stress for you. So it doesn't mean be mean, but it means stand your ground. So figure out what self-care looks like for you and develop your own self-care plan because it's different for each person. Next slide, please. Trying to be cognizant of time, Kelly. All right, so something else that we can do is get your body moving because that helps your mental wellness. So how many of you all do some type of aerobic activity and then some type of muscle strengthening activity during the week? I see some thumbs up. Yes. So for me, I'm a runner. So I run at least 3 or 4 times a week. And then I do a boot camp in the morning at 5 a.m. That's what works for me. That's when I get my mind. I always say, get your mind right, get your mind right. So in the morning, I'm getting my mind right before I even start my day. But that works for me. So get your body moving, whatever works for you. If it's line dancing, it's kickboxing, it's swimming or whatever, get that going because that is to keep you mentally well. Next slide, please. Practice self-compassion is a form of self-care. So a lot of times we focus on everyone else, but how about being kind to yourself? How about being supportive and really sitting with yourself and saying, you know what, I'm feeling some kind of way today. I'm really not feeling 100%, and it's okay. And I'm not going to beat myself up about it. I'm going to allow myself to sit here and feel what I feel. And tomorrow I will work on that. And then connectedness, making sure that we stay connected to other people. But more importantly, when do you connect with yourself? So a lot of times when I ask this question, people will say, well, I go out in nature and I connect with myself, or I connect with myself through prayer, meditation. But you have to find a time to connect with yourself so you can be your authentic self with you. Okay. And then mindfulness is just being aware of what is going on with me and being honest and accepting it, because a lot of times we don't just sit and do a body scan. Like, how am I feeling from my head to my toe? How many times do we do that? Or we just sit and see, how am I feeling from my head to my toe? Do I have any aches and pains from my head to my toe? We don't often do that, but it's okay to do that sometimes because that is practicing self-compassion. Okay, so we want to practice some mindfulness, so self-kindness and connectedness. Next slide, please. We need to unplug. Yes, take time to break from your social media, your phone, your email, your laptop, your Chromebook, whatever it is. We have to do that. Put your phone on do not disturb at a certain time. So people should not have access to you 24/7 unless you have a job that requires you to be on call 24/7. If you don't, then no one should have access to you like that. So take that break, unplug. Even if you unplug for 1 hour or 2 hours, it's important that we do that. That is a form of self-care as well. Next slide, please. Let me ask you this. You can stay right here. Who has unplugged before? Give me something, some love, some claps or something. Who has unplugged? And that was your form of self-care and you felt better because you unplugged. Yes, I see some high fives. So the reason that we need to unplug is because when we're always plugged up, it can cause brain fatigue, eye strain, neck pain. A lot of people have insomnia because they're always plugged up. They have the computer in their bed, they have something underneath their pillow. That causes sleep disturbance. And then it can also cause a loss of attention span. So this is why we want to pay attention to and make sure that we unplug sometimes. Okay, next slide, please. Don't be afraid to ask for help. That is a form of self-care. Asking for help. Kelly, I need some help. I know I said I could do this, but I can't. It's too much. Or my cup is running over. My plate is full and I need some help. Many people are not comfortable asking for help, but asking for help or receiving help, that is a form of self-care. Okay, so ask for the help and then receive the help. Next slide, please. We talked about the power of no. This is one of my favorite quotes about no. No is a complete sentence. It does not require justification or explanation. No. Before I got on this call today, this lady asked me if I could come and speak. I think she said on February the 16th. I said, no, I'm already booked on February the 16th. And then again, here comes my boundaries. She said, well, what time are you speaking on the 16th? I said, I'm speaking in the morning. She said, well, maybe you could come and speak for me in the afternoon. And I said, no, maybe another time. I'm not available. I'm not overextending myself like that anymore. Back in the day, I would have done one in the morning and one in the afternoon, and then I would have been extremely exhausted. So no, I'm not doing it. So saying no to others allows us to say yes to our self-care. So remember that. Saying no to someone else allows you to put yourself, make yourself a priority. Next slide, please. Here are some practical tips. I'm not going to go over all these because you guys can read, and I did send a presentation to Kelly. Plan what you can. That helps. That is a form of self-care. When you have a plan, we already talked about boundaries. Make sure you get outside when you can and get some fresh air, even during this time when it's extremely cold in the Chicagoland area. Get out and get some fresh air. It's good for your mental health, and it's a good form of self-care. Take breaks. I always like to use this as an example in the hospital. The people that smoke take their breaks. And I learned from them, because every time when they went out to take their break, I would go out and take me a break too, because I need a break too. So they would remind me that I needed to take a break. So take your breaks, and connect with other colleagues. Okay, connect with other colleagues. That is a great form of self-care. Next slide, please. Only thing I would say on here is make sure you check in with yourself frequently. Ask yourself, what can I do to help myself cope? Focus on what you can control, because some of this stuff, guys, you know how stuff changes in healthcare. It changes every other day in school systems. It changes every other month, every other week. Some of those things we can't control. So focus on what we can control, practice boundaries, say no, and then check in with yourself to see what your level of anxiety is, because many of us have anxiety because of all those changes. Next slide, please. So I have to the left, I'm sorry, this is self-care, and self-care is all of these things. It's rest, it's curiosity, it's kindness, it's community, it's all of those things. And then what we have to do is create our own self-care plan. So on the right, there's a plan. This is a sample plan. There's mental in one circle, physical in another circle, and emotional in the other circle. There's different types of self-care. So you have to figure out, which area do I want to focus on? Do I want to focus on mental? Do I want to focus on physical, emotional, or do I want to do all three? It's up to you. But come up with your own self-care plan and then execute it and carry it through. Okay. Next slide, please. This is something that I came up with. It's the acronym SELF. So check in with yourself to see, how have I been sleeping? Like, think about it right now. Today is Friday. During this week, just think about, on average, how many hours of sleep did you get? If you have a smart watch, like I do, your watch tracks it for you. So just look on your watch. It'll tell you how you slept for the whole week. Okay, so check in to see how you've been sleeping. How often have you moved this week? Again, my watch tells me, it's like, oh, you off. Last week, you moved 45 minutes more than you did this week. So how are you moving? Your movement. L is for leisure. Guess what? We should be having some fun. We shouldn't just be work, 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 work. We should be having some fun. Somebody put it in chat. When was the last time you did something for fun? Put it in chat. Okay, and then the last thing is food. You want to track and see how you're eating. So how you sleeping, how you moving. Check your fun resume, because some of you all need to update your fun resume. You know who you are. One time I asked this question to someone. I said, when was the last time you had fun? The man said, 19. I said, 19? 19 what? He was talking about like 1998. That was the last time he had some fun. And this was in 2023. So let's update our fun resume. If we haven't done anything for fun, make it be deliberate, not intentional. Be deliberate with that, and then see how you eat it. So this is a good way to just check in with yourself. Next slide, please. We're right at 3, Kelly. I'm almost finished. This is a 30-day self-care challenge. So I encourage you all to do the challenge. Maybe get a group of people, hold each other accountable. If you don't have an accountability partner, get you an accountability partner so that you all can make self-care a priority. Okay. And there's all different types of stuff on this stuff. The different colors, I mean, have different meanings. So this is just something as a takeaway. Next slide, please. I'm not going to do the closing activity, but you'll have it. It's called brain massage, and it's something simple that you can do when you feel overwhelmed. So if you're overwhelmed and you're at home, you can stop and do this brain massage. And if you're in your office, you can stop. It's good to do it with kids. I taught teachers how to do it in the classroom setting, and it's good to do with staff, maybe at the beginning of a meeting, so everyone can calm down and get ready to focus on what we need to focus on this agenda for the meetings. So again, that's brain massage. Next slide, please. Here are some resources. There have been a ton of losses. I know you all know, especially working in the school. Griefshare.org is a great organization. I love Griefshare because you can put in the zip code and all of the resources on grief in that zip code will come up for you. So some are virtual, some are in person, and they have Griefshare for kids. They have it for adults. So it's a great resource. NAMI.org. I'm sure everyone is familiar with NAMI. I'm in the South Suburbs, so I put NAMI South Suburbs. Psychology Today is a great resource. And then if you work for an organization that has an employee assistance program, look into your employee assistance program and see what the offerings are and utilize them. And then these are just some other free resources. And American Heart Association is another big one that has a lot of free resources. They have cooking classes, meditation, workout classes. So go onto their website, American Heart Association Chicago, and you'll see tons of things. Next slide, please. All right. We right at where we at? I think we at 302, Kelly. I think I made it. So
You did.
for
I
your
was
exit,
watching.
okay, for your exit ticket, I just want people to just, if two people can tell me something, you can answer one of these. So 3 things that you learned today, two things you found interesting, or one question I still have. So if 2 people can give me an answer, and then we are done.
If it's quicker to unmute yourself than type, feel free to do that as well.
Yes.
Well, I'll start it off. I learned that I still have a long way to go, even though I am working on getting better. A few things I'm like, she's talking directly to me. So I know I still have a long way to go, but I'm getting better. I'm more aware.
Okay, good. And that's really what it's about. It's about awareness, and we're all a work in progress. So I don't think we're ever gonna figure this out. We're always, and then some weeks are better than others, some months are better than others. So other thing is with self-care is give yourself some grace. You know, we
Yes.
extend grace to everyone else, give yourself some grace.
We don't do it to ourselves. My son just told me today, I think he was trying to get out of the dishes though, but he just said, cleaning the house can wait, mom. You don't have to stress yourself out. No, you just don't want to clean the house. But he was right in some points. But we
Yes.
did have a couple questions in the chat. When's
Okay.
my next play date? That's a good one. A play date, being a child,
Yes.
just going out and having fun. That's a great one.
Yes. Yes.
Um, Questions on how can they share this information with staff? I take that to mean how can they book you for upcoming professional development and other events if you have your
Okay. And
information that's in
I
the
think it's on the
slide.
next one. Is it on the next? Oh, we were gonna do that. Okay, there it is. Yes.
Okay. And
Yeah.
finding more empathy for myself is another thing someone said in the
Yes.
chat.
Yes. And I think when we're doing the work that we're doing, I don't know about anyone else. Everyone is feeling overworked and underpaid. And I know for many people they've lost staff but aren't able to replace them. So many of us are doing the work of 3 and 4 people. But I just caution you, as you do the work to the best of your ability, but don't forget about yourself. Because what's happening is that people are having heart attacks, people are having strokes because they're so focused on doing the work, and it's making them sick where they hospitalized, so don't forget about taking care of you and still having those clear boundaries. So I don't know if any of you are on TikTok, but on TikTok there's a lady on there, I think her name is Valerie or Vanessa, and she's all about boundaries. So her boss will come in there and say, we really need you to stay late today. Veronica, that's her name, Veronica. She said, we're really gonna need you to stay late today. And Veronica said, well, will I be compensated for that? And then she says, no. And she said, well, I will not be staying after work because I've done my 8 hours for the day. So I will be going home to take care of my family and my kids, and I'll see you tomorrow. She's not being rude, but
Fantastic.
she's being realistic. I have things to do outside of work. So make sure that you have a life outside of work and that work is not your everything, because that's how we make self-care a priority, by making ourselves, keeping your doctor's appointments, keeping your spa appointments. Even if you have a nail appointment, go to your nail appointment. Shouldn't probably have your nail appointment during work, but keep your nail appointment where you're not, your appointments where you're not putting other people in the place where you should be. So
Mhm.
that is all I have. Do we have any other questions, Kelly?
No more questions, but Christine says ideas for self-care, putting it on my to-do list. That's a great
Yeah.
idea. That was a great tip that I got as well. Don't think about that when you create a to-do list.
Yes. Otherwise, you'll forget about it, or it won't get done because you didn't put it on your list. So, and then I'll give you one more tip, and then we're done. Something that I used to do when I was at a hospital, I had a sign on my door every day at 10 o'clock, and the sign said "in a meeting." And so my staff was one day, one of my staff members was like, "Felicia, every day you go in a meeting from 10 to 10:30." And I said, "Mm-hmm." And they were like, "Well, who are you meeting with?" I was meeting with myself from 10 to 10:30 every day. And everyone knew not to bother me from 10 to 10:30. And I did whatever I wanted to do during that half an hour of the day. So make sure that you set some boundaries and you make yourself a priority, because I don't want to see you in the emergency room. Okay.
Fantastic. We are so blessed to have you. If there are any more questions or comments, I'll make sure I send these slides out. And we know that other people will be calling you. Eventually, you'll be very hard to get, Felicia. And you're already in demand, but you'll be very hard to get. We hope to have you back with CCDPH to do things for staff as well as for the community. And I'm sure some of the schools will be contacting you for their professional development if they haven't already. If there aren't any more questions, I know you said you had something to do after this, and I want to respect your time and your boundaries, and we appreciate you. And I'm so very happy that you were able to come out to speak with us. And I'm glad that we were able to present this to the school community, as they have stressed, as you said, they are very stressed. They are pulled to their wits' end. They could use some tips, and I hope this served to help you all, and you can spread this to colleagues who weren't able to make the meeting. If there are no other questions or no other concerns, the slides will be sent out next week with all of Felicia's information. And we want to thank Felicia, and we want to thank Colleen as well as Alex for taking the time out of their busy schedules to speak with us. And we will see you all at our next meeting on February 15th, where we will talk about violence prevention in schools. Have a great weekend. Stay warm. Enjoy.
Have a
Thank
great
you
one.
all.
Thank
Bye.
you.
Thank
Bye bye.
you.